Equipment. The range of equipment available for the administration of local anesthesia has been developed as a result of the need for convenience in use and the maintenance of sterility. The equipment necessary for the administration of local anesthesia includes the syringe, the needle, and the local anesthetic cartridge. The syringe. It is one of the three essential components of the local anesthetic equipment. It is the vehicle whereby the contents of the anesthetic cartridge are delivered through the needle to the patient. The basic design of the syringe consists of a metal barrel and a plunger piston united by a spring-loaded or spring-loaded hinge mechanism. At the end of the barrel, there is a screw hook by which the needle is attached. Okay. Types of the syringe. Number 1. Aspirating dental syringe. In this type, the end of the piston has a decal like a hook. This hook will penetrate the thick rubber stopper at the end of the cartridge. The maneuver of aspiration consists of withdrawal of the plunger to create a negative pressure within the cartridge. This maneuver is employed in order to ensure that a blood vessel has not been entered by the needle tip during its insertion into tissue prior to injection of the anesthetic solution. Positive aspiration results in a fine spiral of blood being clearly visible in the solution within the cartridge. 2. Non-aspirating dental syringe. In this type, the piston or the plunger ends in a smooth, flat ends. A slight amount of aspiration may be achieved with this type by making a small initial injection of the solution and then releasing the pressure on the piston, which then rebounds to reduce an aspiration effect. 3. Pressure syringe. The original pressure device using a pistol grip are somewhat larger than the newer pen grip device. This type of syringe is especially designed for the periodontal ligament injection technique. The needle permits the local anesthetic solution to travel from the cartridge into tissue surrounding the needle tip. Most needles used in dentistry are stainless steel and are disposable. All needles have several components, which are: number 1, the bubble; number 2, the shank; number 3, the hook; number 4, the syringe adapter; number 5, the syringe penetrating end. When needles are selected, 2 factors must be considered. Number 1, the gauge. Gauge refers to the diameter of the lumen of the needle. The smaller the number, the greater the diameter of the lumen. There is a trend toward the use of smaller diameter needle because they are less traumatic to the patient than the needle with a greater diameter. In dentistry, the most commonly used gauge are 25, 47, and 30. 2. The length. Dental needles are available in 2 lengths. Long, average 32 mm, which used in the mandibular injection, and the short 20 mm, which used in the maxillary injection. In general, the long needles are preferred for all injection techniques. 3. The cartridge or cardboard. The dental cartridge is a glass cylinder containing the local anesthetic solution. It is manufactured to hold either 1.8 or 2x2 of the local anesthetic solution. It consists of A. Cylindrical glass tube; B. Stopper located at the end of the cartridge that receives the hook of the aspirating syringe. C. Aluminum cap is located at the opposite end of the cartridge from the stopper to hold the diaphragm in position. D. Diaphragm. Clinical problems associated with the equipment used in the local anesthesia. Number 1, leakage of solution during injection. The leakage of the anesthetic solution into the patient mouth during injection will occur if the cartridge and the needle are improperly mounted into the syringe. When the needle is properly placed on the syringe after the cartridge is inserted, the needle produces a centric perforation of the diaphragm that tightly seals itself around the needle. When pressure is applied to the plunger during injection, all solution will be directed into the lumen of the needle. When reloading a syringe with a second cartridge and the needle already in place, an eccentric or void perforation may occur, diaphragm, and with the pressure on the plunger, some solution will be directed to the lumen of the needle, and some may leak out of the cartilage between the needle and the diaphragm and runs into the patient's mouth. 2. Broken cartilage. Breaking of the cartilage may result from a weak needle at its proximal end, which may not perforate the diaphragm of the cartilage. Positive pressure on the thumb ring increases intracartilary pressure, leading to breakage. A broken cartilage may also result from the bent hook of an aspirating surge. Clinical problem related to the dental needle. Number 1. Pain on insertion. This may be avoided by using sharp new disposable needles and the application of topical anesthetic at the penetrating site. 2. Breakage. In general, bending of the needle during insertion weaken the needle, making them more likely to break on subsequent contact with the hard tissue such as bone. 3. Pain on withdrawal. Pain on withdrawal of the needle from the tissue can be produced by fish barbs on the tip. These barbs may be reduced during the manufacturing process, but it is more likely that they occur when the needle tip forcibly contact the hard tissues such as bone. Therefore, needle should not force against resistance. 4. Injury to the patient or the administrator. Major cause of injury is carelessness and inattention by the operator, although sudden unexpected movement by patients is also a frequent cause. Therefore, the needle should be capped until its uses and should be recapped immediately after withdrawal from the patient's mouth. Clinical problems associated with the dental cartilage. Number 1. Bubbles in the cartilage. A small bubble approximately 2 mm in diameter will frequently be found in the dental cartilage. It's composed of nitrogen gas, which was bubbled into the local anesthetic solution during its manufacture to prevent oxygen from being trapped, which may be present with a plunger that is extruded beyond the rim of the cartilage. Is the result of freezing of the anesthetic solution. This cartilage should not be used. Sterility of solution cannot be assured. 2. Extruded stopper. This stopper can be extruded when the cartilage is frozen and the liquid inside expands. In this case, solution cannot longer be considered sterile and should not used for injection. Also, an extruded stopper may be due to prolonged storage in a chemicals affected solution and diffusion of the solution through the plunger through the rubber diaphragm into the cartilage. 3. Burning or injection. A burning sensation or injection of an anesthetic solution may be the result of one of the following. Number 1. Normal response to the pH of the drug. The pH of a dental cartilage containing vasopressor is 3.3 to 4, which is lower than that without vasopressor, which is 5.5 to 6. Because of this pain anesthesia have somewhat more rapid onset of clinical action and more comfortable, less burning or injection. 2. Cartilage containing sterilizing solution. This occurs when the cartilages are stored in expected solution for a longer period. So we get diffusion of this affected solution into the cartilage. Upon injecting these cartilage, we get burning sensation. 3. Overheat cartilage. Local anesthetic solution injected at a room temperature are well tolerated by tissues and the patients. Overheat cartilage produce burning or injection. 4. Leakage during injection. 5. Broken cartilage. Preparation of the equipment. Proper care and handling of local anesthetic equipment can prevent or at least minimize development of complications associated with needle syringe on the cartilage. Steps of preparation. Number 1. Remove the sterilized syringe from the container. 2. Retract the piston fully prior to attempt to load the cartilage. 3. Insert the cartilage while the piston is fully retracted into the syringe. Insert the rubber stopper end of the cartilage. 4. Engage the hook. Push the piston forward until the hook is firmly engaged in the plunger. 5. Attach the needle to the syringe after removal of the plastic cap from the syringe end of the needle. 6. Carefully remove the plastic protective cap from the opposite end of the needle. Expel few drops of solution to test for a proper flow. 7. The syringe now is ready for use. 5. After administration, retract the piston and pull the cartridge away from the needle. Then remove the cartridge from the syringe.